She used to be a very capable lady, but after the death of her husband, because no one talk about the husband, no one works on her emotional needs. So from time to time, she got absent-minded and she will go back to the hospital.
Wow, and this was the starting of recognizing that grief can manifest in such a way that changes a person so much.
This is an important topic, and this is the lessons that everyone have to face.
A secondary school student stabbed another student and was fatal. I think that brought a lot of fear and sadness. As well, Hong Kong, the fires were really such a big tragedy. Is there anything that people at home can do to support their neighbors, to support their community? Hi, welcome to Dr. Comfort GPS. This podcast is to share valuable lessons from palliative care. Now, I'm Win Lin. I'm a palliative care specialist from Malaysia. And many people ask, what do palliative care people do? So we care for people with serious illness. And there's so much to learn from this journey. And today we have a very special guest, Prof. Amy Chow. She's a professor from Hong Kong University. She has spent her entire career researching on grief and bereavement. She has also other leadership roles, shaping how society in Hong Kong thinks about bereavement and support for the community care. So here, thank you, Amy, for being here.
Thank you for inviting me.
Yes. We would like to just start off by understanding what drew you to this work and what motivates you to spend your entire career in this.
So I don't think I'm the one to choose this career. It is the reverse. I have to say I'm lazy. When I first start doing research, I want to find a topic that is not well researched and be easier to work on. And that's why I work in end-of-life and palliative care. And then people start to talk about, we only care for the patients, but how about when the patient passes away, what should we do? And then I think this is an important topic. No matter illness or whatever, people eventually will die. And this is the lessons that everyone have to face. But we take it as a taboo. So it is a meaningful topic.
Wow. And in the medical social worker background, how did you encounter with patients? Is it in a hospital setting or is it in a community setting? How was that like?
So I first started as a medical social work in the medical setting. Maybe I share with you a life-changing story that I got. One day when I was passing through the hospital, I saw an old lady asking for help. She said, I want to find my husband. I want to find my husband. And then I said, oh, which ward is your husband staying at? She said, I don't know, but I miss him. He is in this hospital. Now, so I bring her to the registration desk and to check the name of her husband. But we couldn't find any patient name of her husband. Now, but since she is of old age, I do think the husband should be an old age man as well. So the easiest way is to bring her to the geriatric ward. Now, when I was walking together with this lady, she shared a lot of worries about her husband. But when we reached the geriatric ward, do you know what happened? The nurse just come out and say, oh, it's you again. Your husband has passed away. Why are you coming back? Now, at that time, I was so shocked. And then she said, my husband passed away? And then I bring her to my office. I try to listen to her worries, listen to her stories, and then I call her daughter. Her daughter actually told me that, yes, this is already the 4th time she came back to the hospital. Her grief was not handled, and she developed some confusion in her mind. She used to be a very capable lady. But after the death of her husband, because no one talk about the husband, no one works on her emotional needs. So from time to time, she got absent-minded and she will go back to the hospital. Now, so at that moment, I do think this is an important topic because it's happened to everyone.
Wow, and this was the starting of recognizing that grief can manifest in such a way that changes a person so much.
Exactly.
In society, you mentioned that just now, that death is a taboo topic, especially I think in whether it's Chinese culture and many other cultures as well. How would you advise younger generation to approach this topic with their parents? Because sometimes it's practical, like maybe they are downsizing the house for easier management, but they can't approach the topic without having the hint of patient they are actually deteriorating and moving nearer to. How would you advise the younger generation? How would you advise the younger generation?
Now, most of the time, death is a taboo topic for everyone. And then you should find the right timing to talk about it. Now, if it is a dining time, if it is a festive day, if you bring this topic to the table, I think your parents will be very angry and no one will follow the topics. But when we are like watching television program, when there are themes related to death and dying, we can use it as a starting point and say, this old lady would like to have this arrangement, but I think this is not good. How about your views? And so that start the conversation easier and make it appropriate. Now, and also in Chinese culture, we have some festive day related to death and dying, like the Qingming festival. You need to go to the grave tomb, the cemetery to pay respect. And maybe that can also be ways to talk about. So instead of talking about directly, try to see what is the right moment and see how the parents are facing, how the parents are reacting. Yeah.
Okay, yeah, that is very, very practical, and I think so much easier to do rather than coming in hard on, I want to talk about this topic. Yeah. When we talk about this normal phenomenon of life, I think in Mandarin we have this saying that we are born and then we grow old and then we get sick and then we die. But this whole process involves a lot of loss. So loss of what I used to be, like you mentioned that lady just now, she was a very capable lady, but now she's going back to the ward multiple times just to, and appears very absent-minded. And there's so much loss involved. And then that will bring about, some people say that it's grief. What is grief, Amy?
So in a very general sense, we would say grief is actually the price you pay for something you love. So if you own something, if you have something, then there will be a chance that you will lose it eventually. So it is a price that you pay for your love. Now, but academically, there is another term like grief is actually the reaction towards loss. No matter it is emotional, cognitive, or even someone who have physical symptoms at the manifestation of grief.
When do we experience grief? I'm just thinking, is it only pertaining to loss of a loved one forever? Or is there grief in everyday life?
Now, in the past, the scholastic people are very rigid. They only restrict grief to death loss. But nowadays, as you said, every day we have different types of grief. Like sometimes you lost your wallet, it is a grief. Your boyfriend break up with you is another grief. And in particular, in the current economic situation, sometimes you lost your job, it can be grief. And actually, I was told by some of my students, when they graduate, it is a grief because they lost the community of being a student. They have no privilege to have the discount rate to take a bus. So it can also be grief. Yeah.
Oh, wow. Okay, that makes a lot of sense. Whenever there's a transition in our lives, we move into a new role, there's a loss of an old role. But the grief comes with a lot of sadness. Is sadness the only emotion in grief?
It has a belief that sadness is equate with grief. But in reality, most of the time, maybe anger, maybe shockness, maybe some guilt, self-blame, and also jealousy can be reaction of grief as well.
Could you give us an example of how does that look like?
Now, just talking about breakup.
Yeah.
Now, if I break up with my boyfriend, if I walk along the street, I see couples holding hands, I have jealousy. And I also have anger. Maybe the anger is towards the boyfriend. Why you dump me? But at the same time, the anger can also towards myself. Am I not doing good? That's why we cannot stay forever. And sometimes you can't accept the reality. You think, oh, maybe this is just a temporary arrangement. I was shocked. I have no feelings. And maybe that can be react. In particular, after the breakup, you don't have a sense of hunger. You don't have any sense. You don't feel any thirsty. If you watch any movie, you don't have reaction. And that is also shockness and numbness representation.
Okay, yeah, that resonates so much. Now I understand what I was experiencing. Even something like I was having this back problem and I couldn't walk for a bit. And then when I saw people walking, I was like, why can people walk so well? Yeah, it's actually just jealousy.
Yeah, and they think it is unfair. Why me? Why not the others? Yeah, I haven't done anything wrong. Why this happened to me? But they forgot that everyone, you will have a limit. Not everything will be permanent.
But because grief is associated with a lot of these strong emotions, I guess a lot of people will be asking, when can I get out of grief?
So someone may not have strong reaction, but in majority of the case, they may feel the strong emotions. There is a belief that you can never get away because as you progress, there are reminders, there are triggers. Now, say for example, when the kids lost their parents when he was young, it seems like he's working well, he's overcoming his reaction, and he can go to school good. But when he started to have the graduation of his primary school, when he saw other parents attending the graduation ceremony, and the grief will come back again. And then when he went to university, when he got married, all this life event will make him feel that I wish my mom is by my side. So it is lifelong. It is up and down. It's never end. As long as you still got the memory, as long as you still have the love with that person, grief will extend, but it will less affect your daily living.
So I wouldn't be surprised if after 20 years, I would still feel a little bit of jealousy why I do not have that and so on. I think recently in Malaysia, we had the very recent secondary school stabbing incident. A secondary school student stabbed another student and was fatal. I think that brought about quite a large collective at the societal level, a lot of fear and sadness as well. And as well, Hong Kong, the fires were really such a big tragedy. In trying to make sense of grief at a societal level, in a collective grief, is there anything that people can at home can do to support their neighbors, to support their community? What do you think about that?
So it is not easy because the event nature have the trauma element. So trauma actually makes you immobilize, exaggerate your fear, you feel the insecurity. So the first thing is to make sure you feel safe. You do something that makes yourself calm down. That is important. The society is still safe. But think about what are the things you treasure. You reevaluate what is important in your life and what is also important for your neighbors, for your friends. So that makes yourself have some action. If you do something, you feel more secure. But if you keep on thinking, if you keep on experiencing without any action, it will not be good. So I would strongly encourage, once you become more emotionally stable, try to do something that is meaningful for yourself and also for your neighbors.
Okay, so being very practical, calm myself down first before helping my neighbor, and then try to think of a practical thing to do for others. When we understand about grief better, then we also leads to the next question, and it's surrounding this as well. If I want to help others, I think for healthcare professionals, doctors, nurses, when we care a lot for a patient, we tend to feel very much for them, and at the same time, sometimes we feel the sadness together with them. And I have also had colleagues who say that it's too painful to feel so much emotion when caring for another person. Therefore, I do not want to feel this anymore. I numb myself. And therefore, I stop caring and I just carry out the task without emotion, without empathy. Any thoughts on that?
So, how should I say? Actually, if you want to be a very committed healthcare professional, you need to step yourself into the shoes, you need to care for that person. But it is about the dosage of your involvement, of your emotional involvement. So you need to understand how they feel, you need to care for that patient, but not overwhelming your whole self. Now, so I think there is one practice that is important. It is called the transitional rituals. Now, so you remember when a nurse go to work, usually when they step into the hospital, they wear their own clothing. But once they go to the hospital, they change their uniform and then they start to work as a nurse. But before they go back home, again, they take off their uniform. They also take a bath, a shower to clean everything, and then dress back their normal clothing and go back home. Now, I think this is a good analogy. So when we need to step out of our work, don't carry your work back home. So you take a bath because you want to make sure the germs and all the infectious stuff is not with your body and you don't affect your family. Similarly, your emotional stress, you also need to take a shower. But of course, this is not the real shower. I often suggest someone to find some of their own rituals. Like you can pass through a garden. You are putting down all your emotional burden before you go back home. Or someone may do some shopping, but I strongly encourage window shopping, no real shopping, or else all your salary will go to the company and you have a debt for your credit card. So find something like that, or you actually like drinking a cup of tea, or maybe you go to a church to do something. And this transition will help because you make a clear boundary of your work part and your personal life.
Yeah, I'm also wondering about that, whether it sounds like an emotional, spiritual cleansing, I guess, before when we transitioned. But if they do they feel that if I really do care, then I should care all the time? Is that it?
But you can have a reflection. If you care all the way, round the clock, bring everything back home, do you actually improve your quality of service? Now, surprisingly, if you take yourself off, protect yourself when you are in the family, you find the time to rejuvenate yourself. The next day, when you go back to your work, you are more energized and you have the motivation and energy to perform a better role. So it is not about the time you think about the case. It is more about the ability and your energy level. So you nurture yourself before you keep on offering yourself. Because if the next day, if you care for a patient, you think about him, you can't go well to sleep. The next day when you get up, your physical condition is not desirable. And when you see the patient, maybe you do not have the energy to fully contribute. But in reverse, if you have a good sleep, you blanket off your emotion. The next day, after recharging, I do think you will bring a new personal, new energy to the patient. That may make more sense. And frankly speaking, I don't think your patient wants you to think about him or her so much. They care for you as well.
Wow, that is very, very heartwarming to hear. I think many healthcare professionals need to hear this rather than numb themselves from all the emotions, and just because they are caring for people. If there is some of the doctors and nurses mentioned that when they're caring for someone and sometimes they feel like their tears are coming on when they see something very sad happening with the patient. And maybe the patient is crying or maybe the patient is telling their stories. And they find it very hard to hold their tears in. Is there any advice for that?
Now, I think first of all, you need to ask yourself, what are the tears for? If the tears are related to your own personal story, you worry about your family members, you have some past experience that make the tears, I think you need to rationally turn it off and try to control yourself. Now, but most of the time it is not the case, because a lot of our healthcare professionals, they are very committed, they are very devoted. They easily empathize with the patient. So if it is naturally a response to the patient's stories, I actually think it is okay. And patient will find that you understand how they feel. I do think it is much better than word saying that I understand you. The tears actually already show you understand, and that human connection is more therapeutic. Now, I actually also have this puzzle. I asked my teacher. My teacher asked me another question. He said, if you talk with your patient and he says something very happy, will you laugh? And I said, of course. And then he said, so if he says something negative, emotional, why can't we cry? So I think that is a very good reminder, and I still keep it. Yeah, I laugh with my client. I also cry with my clients.
Oh, that's beautiful. It's just another person communicating with another person, not a doctor, nurse, and a client, or a therapist with a client. That's wonderful. Amy, you do a lot of work with the community-based support. You are the director for the Jockey Club End of Life Community Care Project. Mm-hmm. And I hear that it supports a lot of end-of-life care at the community level. What are the lessons that we could learn from the Hong Kong experience?
Now, first of all, there is a myth that patients prefer to stay in the hospital. They feel insecure. So when they are facing end of life, they want to go to the hospital. But if you explore deeper with the family, we actually see that there are miscommunication. The patient actually prefer to stay at home, but they worry that it will add the burden to the family. Conversely, the family members think that they are not skillful enough, they cannot take care of the emergency, they are not good nurses. So that's why they want to send the patient to the hospital to have better care. But if we have a chance to let them communicate, and you will see that it is not too bad if they can still stay at home for longer time until the moment that they really need hospitalization. Now, actually, COVID bring this message very clear. At that time, when visitation was limited, when there will still be infectious spread in the ward, people start to spend more time at home until the last moment they will go to hospital. And then they find it is easier. No need to rush to the hospital every day. They can cook the meals and then they can enjoy the meals together. So that makes our project even more important after the COVID. So this is one lesson learned. And secondly, we do research. We try to tap in the information of the patients, like how many days are they spending in the hospital after receiving our service. So we actually find that with our intervention, with our support in the community, the patient and family choose to stay in the community for a longer time. And the actual days of staying in the hospital reduce. And that helps a lot because, if the patient is admitted to the hospital because of other psychological, social reason, maybe it will occupy the best for those patients who have medical, physical needs. They cannot get into the hospital at the right timing. So if we can reduce the unnecessary hospitalization of our end-of-life patient, and their feeling is better, their emotion is better, the family members are better, it is good for the patients, for the family, and also the community, so that the resources can be used more appropriately and efficiently. We actually proven that the government inject like $1 for the project, for the setup of the project and the supporting service in the community. Is save $4 in the medical cost. Wow. Because of the reduced medical admission, and also reduced use of ICU, reduced use of admission to the A&E room.
What are the components of the community support that exist in that project? Yeah.
So we first start off with healthcare professionals of nurses or social workers to do the assessment. We mainly assess the 3 dimension, whether they have some psychosocial needs like miscommunication between family, some unfinished business, some family conflict. The second dimension is related to physical symptoms, whether they are symptoms that can be difficult to treat, but the medical team cannot find how to alleviate the physical symptoms. And finally is the practical needs, like are there any barriers like wheelchair or any other accessibility issues that is practical, or maybe some financial, or maybe someone they need respite care but no one to take care of them. And so we do the assessment. So if they are having psychosocial and spiritual needs, then we will refer the appropriate professionals to do the counseling work and to support the patient. If they need practical needs, we also link up with community resources or the centers that we are providing. They have their resources. They try to link up the family and the patient with the resources. And finally, if they are having some physical illness issue. Now, we either use some non-pharmaceutical intervention like breathing exercise, or even some patient, they have breathlessness. We find that if you have a fan, maybe it helps. So we try to use this kind of non-pharmaceutical approach to see whether the patient's symptoms can be managed. But a lot of time, we actually find that the physical symptoms are linked up with psychosocial dimension as well. So if the psychosocial dimension, the family conflicts or whatever has been handled, the physical symptoms also drop. Now, but other than that, we want to have a community support. So we are not only provide everything by professionals, because we can't have unlimited resources, train up a lot of workers. So we also recruit community volunteers. They might be carers of other patient, but maybe the patient passed away. They still have the skills, they still have the passion, so they become volunteers to support the family members. And also we link up the normal service with the patient, empower them to have the knowledge about the community resources, empower them with the ability to handle their symptoms, and turns out to be good.
In terms of service building, because this really sounds like something that could really help many communities around the world. If there was a person, a donor, someone who has a significant amount of a budget who would like to participate in building a project like this, and then there are volunteers, how would you advise people to come together and organize themselves? Because people may not know each other and may not know each other's intentions. How would that actually come together?
So I think death is an event that happens to everyone. And a lot of time the funders, the volunteers, they are linked up with one common ground, the sense of humanities. So a lot of time we talk about patient stories to start off and to elicit their motivation to contribute. And actually, we don't need a lot of money. I think if someone can orchestra the event in a systematic way, a lot of volunteers also contribute themselves, and even the family members, they will be able to participate only when you teach them the way and give them the appreciation, and then they find the meaning in doing that, they will be able to do it. So I still think the key words is humanities, and also highlight that everyone can have a role, empower everyone to do it, and it can be done. And actually, when I start off in Hong Kong, we also borrow the ideas from United States, from UK. They also have their community work start much earlier than in Asia region, because the medical model, the NHS system cannot support such a big population. In particular, the population is aging. So that's why we also learn from the other experience. But what we add in more unique is the Chinese culture of supporting, mutual supporting. So that is something we add in. We also add in the family element. We do think that the family wants to contribute, want to show their filial piety. So that is something we also emphasize.
I think that is amazing because Hong Kong is a very developed country, and we tend to see that in developed countries, the community is less united in a way. But it looks like when you orchestrate things well, things can come to fruition. And if let's say we're talking about places where community spirit is strong, then we need to orchestrate it in a more targeted direction so that things can come together.
Yeah. And in particular, I think the success rests on our volunteers' age group. Majority, they are the middle age or the retired group. Because of their age, their family members may have terminal illness before, so they are more the subjects available. But this group, they do not need to work, and also they have already sustained their living quite well. So target this group, they can be very good resources, and they are also knowledgeable. Majority of them are also educated. So this is untapped resources in the community. And when we can engage them, it makes a difference.
I think when we talk about community, we also think about what is the general trend. And of course, now with the society moving at such a fast pace, with the rise of artificial intelligence, I would like to ask Amy's ideas on this, where there are many individuals now turning to ChatGPT, etc., to confide in it, their emotional distresses, and definitely along with that, if they are in grief, they will be turning to the chatbots and talking to them. There has been quite a few famous cases where suicides have happened because of misdirection. I think the AI agencies are trying to put in safety features into the AI now. But what are your thoughts of people turning, because these things are available at everyone's fingertips, and people who do not have the knowledge on where to turn to emotional distress for help, then they would just use whatever that's on their phone. How would you advise people to go about that?
So actually, when we talk to people who are in distress, AI may help them to distract their attention, to have some immediate feedback, some ideas. But often, they don't find it therapeutic. When they have a chance to talk to human being, when they feel the touch, the healing effect is much stronger. So I don't believe that AI can replace human being in this kind of psychosocial support. So psychosocial workers will still have a role. Peers will still have a role. So never give up this. Don't say, oh, my friend have an AI they can work on. Secondly, as you said, the company, they are paying more attention. They will acknowledge the limitation and also the ethics consideration. So if the company can place more control and also management of this, I think that will be good. Now, I'm not saying that AI is not working well. AI will be very helpful if you need information or help to organize the stuff in an organized way. But it can be assist of the work, but cannot replace human being. So that is important. But what I'm worrying is the habit, because a lot of our younger generation, they relied on this virtual friend rather than the real friends, then it is an issue. So that's why you see in Australia, they have new regulations. They ban the use of some social media of the younger generation until they reach a certain age. So they really want the people to be more integrated with a real human being. Now, say for example, I think some sports is also important. So it is not only about human interaction. If you engage with your friends, if you engage in some sports activities like football and different kind of exercise, first of all, it is good for your physical health, but actually it is also good for mental health, and also the social interaction will come very naturally. And after sports, you are hungry and then you go to eat together, and that is part of life as well.
Wow. So even managing something like grief, we can't tackle it just solely based on using our mind. We can use our bodies to help us in physical activity as well.
Exactly. Actually, some research show that male may find it difficult to articulate the emotions, and sometimes it is also difficult for them to cry. It is not only about social reason, but they just cannot shed their tears. But my ex-client who are men, they actually said that after jogging, after doing some very vigorous exercise, they sweat. It seems like they are crying. They just let the tears come out of their pores as sweat rather than tears from the eyes, and it makes them feel more relaxed. So I think it aligned with the recent research talking about when you exercise, you have the dopamine being secreted and you feel better. So I do think you have to take care of yourself physically, emotionally, and spiritually when you are facing grief.
And it can be a great bonding time without talking so much if four men come together to play a game of tennis, for example. I would like to move on to caregiving. When a loved one goes through a serious illness, the caregiver has to accompany them through the journey of the whole serious illness until the end. And often the caregiver is facing a lot of emotional stress as well as physical difficulties caring for someone who is getting weaker and weaker. What would you like the caregivers to know on this caregiving journey?
Now, I think a lot of people think that the caregiving is a physical task. They are tired, they are exhausted in doing all this. But in reality, there are other factors. One of them is about you see your loved one deteriorating health. Emotionally, you are also exhausted because you don't want your family members to suffer. So that can also be another source of distress. And lastly, sometimes you also feel that it is so absurd to care. He used to be someone like I saw someone whose husband is very independent, but when the husband become ill and need more support, the wife suddenly find out, how is my husband being so weak, and then she couldn't find a meaning. And that kind of caregiving, it seems like I'm carrying him every day, but I don't see a meaning. Now, so all these three are affecting the person. But can you guess which one have a stronger impact on the caregiver's emotional state?
Interesting. Maybe the seeing the patient's outcome.
Yeah. Now, this is our guess, and someone also guessed that the physical load. So you want to take away the physical load. A lot of the government, they do this kind of work. But from our data, we actually, not your answer, not the common answer, but it is the perception of caregiving. It's how they see the meaning of caregiving. Now, so my suggestion to every caregiver, don't belittle yourself. You have done a good job. I do think your family members can feel the love, but sometimes the illness make them emotionally unstable. The anger doesn't mean that they are dissatisfied with your care. They are only expressing themselves, expressing their frustration. But since you are by the side, you are the most reliable person. So that's why they flow all the bad words and their emotions to you. But it doesn't mean that it is their feeling. So if you see this meaning, you are just by the side of that person. You have tried your best. And I think this is already good enough. Don't blame yourself. But I also want to share another research which may be helpful. Now, we do the analysis comparing someone who do 7 days per week as a carer, but maybe less hour. But for another person, they only do 6 days. But every day it has a slightly longer time. And the total hours, 6 days is longer than the 7 days. Now I want you to have a guess. Which group, the 6 days with 42 hours and the 7 days with 40 hours, which group will have a higher stress?
Yes, that's. I would like to guess the The less stress, maybe 40 hours.
40 hours.
7 days. Yeah.
7 days. But the finding is the reverse. Now, I think you put yourself into the shoes. If you have to work 7 days, I think people will say, no, I want a rest day. But if you need to work extra hours on every day in order to make 1 day off, you will still be ready. Now, we actually find that this is the findings for the caregivers. Now, so that's why I do suggest if you are a caregiver, do find a time for yourself. Again, it is not a selfish behavior. Only when you take good care of yourself, when you are more capable, then you will provide more quality care. So it is fine if you can find someone to take off your work for 1 day, and then you can have some time to make yourself relax, take good care of yourself. Then I think the journey of caring, you can work much further.
Wow, that is very impactful. So prescription for caregivers, take 1 day off. I think we are, I would like to, we're coming towards trying to wrap up. I think you have done so many years of work in this area. What do you hope the next generation will bring forward from this work?
So I think in my time, a lot of the energy is provided to those by health and social professionals. But in future, the need of this palliative care group will be much larger. So I think our energy should be focused on how to engage the community to do part of the work, and then let those who are really in need of professional help, they go to the professionals. And we can develop a caring community, a compassionate community, then it can be helpful. So think back about when we were young. Your neighbors will be very helpful. They will prepare meals for you. They will also talk to you. So you don't need counselors. You don't need someone to home care service to send meals on wheels to your place. It comes from the neighborhood. But because of the development, we become more busy. We don't care about our neighbors, and that is not a good phenomenon. And we depend everything on the government, depend on professional. But I don't think it works, because you can see the cases in developed country. They are now having a heavy healthcare system. So that is my wish. Let's differentiate who are the one who need real professional care, and let the community and let those volunteers who can be ready to support those who are not yet in need of professional care but can be well cushioned and supported by the community.
Let's bring back community care back again. Thank you so much, Amy. I think every very rare once in a while we meet a person whose work changes society, and in this topic that is very universal but very little talked about in grief. So thank you so much, Amy, for joining us today.
Thank you for giving me this opportunity.
Thank you. If you like this episode of podcast, please subscribe below and join us next time on next episode.